Good evening, everyone. It's such a pleasure to have so many of you here with us tonight. A very big thank you for joining us at Lanserhof at the Arts Club. I'm Francesca Ogiman-White and I'm the founder of the Beauty Triangle. Now, we're here this evening to forge ahead and really examine what it's taking nowadays in this very hectic world that we live in to future-proof the female body. After all, I'm sure we can all agree that as time takes its toll, as life moves past, things can really start to weigh on us. Maybe we're sleeping less than we used to. Maybe our complexions are feeling a little under par. Perhaps our energy is flatlining, or our clothes just don't fit like they used to. So what are the simple steps that, as women, we can all take on the every single day to supercharge our skin, our physiques, and our overall well-being? Now, when we started the Beauty Triangle, as many of you know, it was really with the intention to educate and empower our consumer audiences on all aspects of their health and well-being, and always critically from a holistic standpoint, which is why you'll always find 3 practitioners on our panels, each of whom is an absolute expert in their given specialism. But we also set up the Beauty Triangle to have the conversations that no one was really having in the wellness space, and in doing so, to introduce you and connect you to the most expert voices in the world of well-being. On that note, it gives me great pleasure to introduce tonight's amazing speakers. We're joined by GP and functional medicine practitioner here at Lanserhof, Dr. Maria Amasanti. We're also joined by dermatologist and longevity advocate, Dr. Jinah Yoo. And finally, plastic surgeon, reconstructive surgeon, and founder of Real Plastics, Mr. Naveen Cavale. And they're really going to be revealing the most tangible routes to feeling like our best selves, from how to regulate cortisol levels and bolster our immunity, to looking at the regenerative techniques and even the surgical acumen that can really help to make us feel whole inside and out. A little bit of housekeeping before we start. Hopefully you found a program on your seats or on your tables. You've got further information on the speakers on there, and there's also a little referral card. So if you'd like us to connect you with anyone that you hear speak tonight, you can just jot down your email and the name of the practitioner, and we'll connect you afterwards. We'll have time for audience questions at the very end, so if there's anything you'd like to ask, please do fire away to our speakers when we're finished with the main discussion. And finally, we have a really beautiful goodie bag for everyone when you come to leave. It has the amazing elevator supplement from Systole in there, which is packed full of nutrients to enhance your energy, your metabolism, and your immunity. And there's also our favorite Better You magnesium body lotion, which will rest body and mind before bedtime. So please don't leave that behind. That's enough from me for now, at least. I'm going to hand over to our speakers. They're going to say a very quick hello, and then we'll get started with the main conversation. So, Dr. Maria, welcome.
Thank you. Good evening. My name's Dr. Maria Amasanti. I trained initially as an NHS GP, and I now work here at the Lanserhof as a functional medicine doctor.
Thank you, Maria. And Jinah.
Hello, I'm Dr. Jinah Yoo. I'm a Korean UK trained consultant dermatologist. I have my own private practice in Harley Street in Mayfair, focusing on Korean dermatology treatments and also more recently combining with longevity treatments.
Amazing, thank you. Nav.
Hi, my name's Naveen Cavale. I'm a London plastic surgeon. I've got an NHS practice at Guy's and St Thomas's and King's, and I have a private practice in Battersea at the Real Clinic.
Amazing. Well, thank you, all of you. And you all have such fascinating backstories and specialisms. I can't wait to get talking with all of you. But our first speaker is Dr. Maria Amasanti. She's already introduced herself. But I think as you'll hear from our conversation, Maria's approach to the human body really leaves no stone unturned. And I find that incredibly sort of relevant to how we're living in the here and the now. But we're very much here tonight, Maria, to discuss how to future-proof the female body. And I'd love to get your perspective on what the biggest hurdle that women are probably coming up against in the here and the now is and what you're experiencing.
So I would say if there's one way to future-proof the body, it is mitigating chronic stress, which is linked to cortisol, which is the king of hormones. It is the only hormone in the body that in theory does not decline with age. It is the last hormone in the body to leave the body when we die. It trumps every other hormone.
That's fascinating. I had no idea that everything declines as we age, but of course cortisol doesn't. Classic.
Yeah. So when it comes to I think we need to define what do I mean by chronic stress, because people say stress, it means I'm in a traffic jam, I'm running late for a meeting. Yes, that's one example. But you've actually got 3 categories of stress. So you've got physical stress. And what does that cover? So infection is a huge one. So say, for instance, you have your gut is out of balance, which is incredibly common. That takes energy. The
coughs and colds and all the bugs
the
that are
common
just going
cold,
around all the time.
The common cold to COVID, to you name it, to gastroenteritis, your levels of vitamin C and your B vitamins will absolutely plummet, something that the adrenal glands really rely on. Other physical stresses can be lack of sleep, changing time zones. But then there's also things that we don't think about, like the microplastics in your gym leggings, or the bleach in your sanitary towels, or the pesticides in your food, or aluminium. There are so many toxins these days. So that's your physical stress. The second category would be hormonal stress. So that's from your first cycle as a young girl, every period you have, every pregnancy, every miscarriage, perimenopause and menopause. Now, by and large, there's not a lot that you do about that. That's the path of life. And then the third category of stress is emotional. And really, take your pick. It can be being in a traffic jam and being late for a meeting. It could be a divorce. It could be a tax bill that you didn't know about. It could be an argument with a loved one. It could be trying to get onto a Zoom and your computer fails. I mean, it really could be anything. But what you need to understand is that our bodies and our brains have not changed from when we were primitive women, from 500 years ago when we were running over the African plains chasing deer.
As hunter-gatherers.
As hunter-gatherers. We haven't changed from that. But fast forward to 2025 and everything else has. But the primitive brain, so we were meant to have stress, absolutely. Stress in a short, acute burst is actually very good for us.
I guess it kept us alive, didn't it, in the face of a tiger?
But it was over soon. It was over quickly. 10 minutes. You either died or survived. And you've got 2 nervous systems. You've got your fight and flight, and you've got your rest and digest. The heart, the whole human body, should be governed by the rest and digest.
I think you said to me when we were discussing this just ahead of this evening that your body is supposed to be in the parasympathetic nervous system 95% of the time.
Yeah.
Which is crazy because my body is not in rest and digest 95% of the day. It's just not. I would have thought it was 50-50. But again, that's just because it's showing us what modern life has done to anthropologically how we're supposed to be, behaving as human beings.
Exactly. So when we were primitive women, hunter-gatherers, if there was that saber-toothed tiger chasing us, or we were fighting an enemy from another tribe, if we survived, great, and then very quickly we would go back to our rest and digest because the threat was over. And so we had that sharp burst of adrenaline, noradrenaline, and cortisol, but then it subsides. Fast forward to modern day, we're constantly pulsating out these micro stressors all the time with the examples I've just given.
And then exacerbating it by having, three coffees a day and not sleeping and all of the things that modern life throws at us that we also have to deal with.
Exactly. So, but the body will always obey the brain. So the brain cannot it's still a primitive brain. So that primitive brain cannot tell the difference between the immediate physical threat of the saber-toothed tiger and when we think about something, or when we, when we get that horrific letter or that piece of news, it can't differentiate that one's going to kill you in the next 2 minutes and that one is a perceived threat. So we start releasing that cortisol, that adrenaline, that
That's
noradrenaline.
so interesting. I mean, it's really funny because I always think that cortisol gets demonized and it gets a little bit of a bad rep, and we're always talking about it in relation to we have too much cortisol coursing through our bodies. But is there also the argument that sometimes we don't have enough because it's so out of sync?
Exactly. So what happens is, in the early stages of what we call adrenal stress, you've got plenty of cortisol in the tank. So when you get these stresses, a normal day of cortisol if you were to test it throughout the day, which we do here, you would see it should look like a mountain slope, a ski slope.
How do you test it?
You can do it with saliva or urine. They're the best ways to test. And I would always test like with like. If I was going to do saliva, then I'd keep doing saliva so that you're comparing the same thing. But a typical day, it should be like a mobile phone. You charge your phone overnight. First thing in the morning, it's high, it's charged, and then you should see this beautiful decline as the day progresses until you get to 10 p.m. and it hits rock bottom and melatonin picks up.
And so you're testing what sort of multiple points during the day so that you can almost plot that on a graph.
That's exactly what you do. So you test it on waking, an hour after waking, midday, mid-afternoon, and then 10 p.m., more or less. Now, in the early stages, if you've got this adrenal stress and you've got enough cortisol going around, instead of seeing that ski slope, you will just see high, 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 high on the graph. But then you're going to get a demand and supply issue because you can't keep up with that forever. So then as adrenal stress continues, what you might start to see is on the graph, low, high, high, crash. Because that morning cortisol may not spike because the body says, hang on, I know that I've got stress to deal with later in the day, so I'm going to hold on to that morning cortisol. As you progress further, and you get this demand and supply issue, you might see low, 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 which you're talking about chronic fatigue at this point. What the body will do is try to play Robin Hood. So the adrenal glands don't just make cortisol, adrenaline, and noradrenaline, they also make sex hormones. So DHEAS, testosterone, estrogen, progesterone, pregnenolone is the grandmother hormone. As we progress through the path of life, we rely more on the adrenal glands for our sex hormones than we do necessarily the ovaries. Now, you imagine you've got one tube that comes down and trifurcates. It goes into 3. So you've got your raw material for all your sex hormones and stress hormones is cholesterol. And I'm going to let that hang just for a second. Cholesterol is the raw material for all of your hormones.
Again, the thing that's demonized. It's so interesting because it just goes to show, we think these things are good or bad, and actually everything is necessary. It's just about the quantities and the balance of it. Yeah. Sorry, back to cholesterol.
So you've got cholesterol, you go down to pregnenolone, and then you go, I'm simplifying, but say you go progesterone this way, cortisol this way, DHEAS, testosterone, estrogen this way. So the body will say, okay, like I said, cortisol trumps every other hormone. And if the brain tells the body to release cortisol, it's going to find a way to do it. So it says, okay, I'll steal from the rich and give to the poor. I'll play Robin Hood. So what it will do is turn down the tap a little bit to your DHEAS, which then cascades down to testosterone. Yeah. I'll turn down the tap a little bit to progesterone because it's okay if I skip a period or if I lose a bit of hair or if I've got brittle nails because they're not lifesavers. But cortisol is. So I'll turn down all those taps to redivert to cortisol because I've got to keep going. But then you get the knock-on effect of your hormones being stolen. Now, if I get, say, a 28-year-old woman who comes to me who is trying to conceive and it's not happening, or she's miscarrying or can't conceive full stop. But then taking the history, you see that she's doing 4 HIIT classes a week, 2 10Ks a week, and eating 800 calories a day.
I mean, the proof is in the pudding.
Well, the primitive brain, remember, the primitive brain says, hang on, I'm in a famine, and it's like World War III is going on here. I'm running from something all the time. I'm doing the best I can to keep my own body going, let alone carry, a 9-month pregnancy. Now, if you go further down in age, women sometimes think they've gone into an early perimenopause. They've just got cortisol dysregulation.
God, that's absolutely fascinating. I mean, sometimes I think there are all of these sort of incredible wellness trends and treatments and therapies, but how much good is it actually doing our body to be doing the intermittent fasting, to be doing the cold water, to be doing everything to the excess? I mean, I think you've just pointed it out. It can really have a detrimental effect if we're doing it to the extreme.
Well, if your tank is empty, so intermittent fasting is great. Cold water, sauna, they're all great. but not if there's nothing in the tank.
Agreed. You mentioned the vagus nerve earlier as sort of being this great conductor of the parasympathetic nervous system, and evidently the vagus nerve holds somewhat the key to keeping that rest and digest in sort of perfect sort of balance. Is there anything we can do to improve the vagus nerve or to help regulate it in some way?
Yes, so there's a few things you can do. So breathing exercises, the 4-7-8 breath work. I don't know. So you
So in
for 4, hold for 7, out for 8.
And what does that do?
It resets. It puts you back into parasympathetic, and your heart rate variability will improve doing that. And it's super easy. Singing, humming. That's why cats purr. They're regulating their vagus nerve.
Oh my God, I love that. So singing as well, because or humming, because is it the vibration,
because
or is it because it's distracting your mind like counting would be?
Because the vagus nerve is the longest nerve in the body, and vagus means vagare, to wander. So it wanders. It goes from the back of the brainstem, and it goes all the way through the torso, touching all the major organs, but it finishes at the diaphragm. So when you hum and sing, you're stimulating it.
Love that. What a great idea. Okay, so singing,
humming, and then there are things like wearables as well. So there's a device a colleague of mine swears by called the Pulsetto that you wear, and it stimulates the vagus nerve. Weighted blankets. I mean, that's an old yoga tradition, actually.
Really?
If you, in Iyengar, I know that they put the heavy wool blankets on you to just settle things, and it can feel quite nice.
That sounds amazing. I would like one of those tonight. Where does oxytocin come into play with the whole sort of cortisol conversation? I mean, we often refer to it as the love hormone, but it also plays a very powerful role when it comes to cortisol regulation, doesn't it?
So if there's one hack that I would give somebody, it is the oxytocin hack. So whenever you think of a loved one, be it a pet, a relative, a partner, a grandmother, or whenever you think of that moment in your life when you've felt grace and love and just utter joy, you start releasing oxytocin, aka the love hormone. It immediately buffers cortisol like that. So because if you think about it, if you're thinking about your lovely dog, you can't be angry. So you buffer those emotions.
There's no space.
No.
And I think that's interesting because that really trips into this concept of social wellness, which I think, it's not often spoken about enough in terms of longevity and future-proofing, but I think it's really important as we age to keep those social connections, those human connections alive. Do you have any tips for people on how to sort of foster those connections in later life or to keep them going?
So what we know is that the other ways to create a really good oxytocin is a physical contact, and that's a hug, a handshake. It can be sexual, intimate relationships as well, but also being of service, being part of a group, whether that's a choir, a knitting group, a meditation group. It doesn't matter.
It's that collective energy and feeling like you're a part of a community, which again goes back to our more primitive mindsets where we were part of tribes.
Yeah. And the last one is really interesting, which is of being of service. Charity work, that kind gesture, it releases oxytocin.
It's so true, sort of the day that you, help somebody off the tube with their heavy bags or something, it gives you a boost, or paying somebody a compliment. Yeah. It's such a nice sort of feel-good factor, and money can't buy that. Can we talk a little bit about sort of cognitive function, brain health, how to keep sharp and focused as we age? Mm-hmm. Are there any things that we can integrate onto the day-to-day to sort of keep that mental clarity? Because I think that's a huge thing that scares a lot of people, that cognitively things might start falling away.
Well, what I would say is, so cognitive function is a huge area, but I'm just going to really look at one very specific thing, which is when you are stressed and you're in fight and flight, the blood supply goes away from the brain and away from the gut, and it gets redirected to the heart, the lungs, and the muscles. Because if you need to get away from a tiger, or you need to fight an enemy from another tribe, you don't need to care about how well you're digesting your last meal, and you don't really need to think.
The body is so intelligent to how it always prioritizes these different systems.
So when you're stressed, you lose all clarity of thought. And I have seen patients where they think their memory is going, but their stress levels are up here.
That makes perfect sense. You know, when you've got absolutely everything going on in your inbox is chock-a-block and you're sort of running behind sort of all day long, and then somebody asks you a question, you just can't find the words. I mean, I've been calling it baby brain for the last 3 years. I think it's just too much going on. But I imagine that's a common thing that sort of people come to you with.
Yeah, it is. I mean, like I say, if you were looking at if someone was coming to you with memory issues, you would need to do a deep dive because there are so many variables. But knowing just that thing about stress, you've got to. When I work with someone who's got adrenal stress, it's all well and good. I can give you the supplements and I can give you the protocol. But when it comes to the emotional stressors, so the 3 categories, physical, hormonal, and emotional, if you don't address those, then it's almost like trying to empty the bath with the tap still running. And that's where the inner work comes and the emotional work comes. And really, if there was a take home that I would say is, love and be happy, because it trumps it all.
And it feeds into everything, doesn't it? And it definitely trumps stress. Final question, because I think immunity is a really, really big conversation. And I know, myself personally, a lot of the women that I speak to, constantly feeling run down is a huge thing. And it only seems to sort of get worse as time goes by. Is there anything we can do to feel more resilient on the everyday in terms of bolstering immunity? Any sort of hacks or at-home tips or things to eat, supplements to take from your perspective?
So supplement-wise, there's the basic no-frills package that I would give 99% of people. So you want a good level of vitamin D. You want magnesium because it's involved in over 300 enzyme reactions in the body. You want good supplies of B12 and vitamin C because, as I said before, when you're under any kind of stress, they plummet. So after a common cold, so us, the fruit bat and the guinea pig cannot make our own vitamin C. Somewhere along the evolutionary pathway, we lost the ability.
I love that that's who we've been grouped with animals.
Whereas all the other mammals make their own, and I'm talking 15, 20 grams a day, the dog, the deer, the cat. So that's like the no-frills basic package. I would say this is the sort of stuff you want to be taking regularly. Coming back to that blood supply thing, when you're stressed, the blood supply goes away from the gut, I said. So what does that mean? You're not perfusing your gut as well. And your gut is your second brain. It's your immune system. It's where you make serotonin. So, and especially here at the Lanserhof, gut is where we start with every patient. It's all about the gut, yeah.
So what does that mean if, the gut is obviously sort of compromised in moments of stress? Are the supplements going to work? Are there other ways that we should be taking them? Is it more about food state sort of ingredients, or what do you advise?
Well, you want to try and get all your nutrients from food if you can, but you actually put there a really good point, which is if your gut is compromised and you're stressed, you may not be absorbing those supplements and you're just spending a lot of money for no reason. So probably at that point, we would do some diagnostics to see what we're really dealing with. And then we move forward with a bespoke protocol, because no 2 people are the same.
I think the personalised approach is what it always comes back to, isn't it? That's so fascinating. I love that conversation and, picking your brains about everything to do with cortisol, oxytocin. That was really interesting. Thank you, Maria.
Thank you.
If anyone has any questions for Dr. Maria at the end, then we'll come to those when we're finished. Our next speaker is Dr. Jinah Yoo, Korean dermatologist with a practice here in Mayfair, doing some really interesting regenerative treatments. But Jinah, you're renowned for your work using lasers, light injectables, and obviously the Korean protocols you referenced, particularly when it comes to future-proofing the skin. But what are the common concerns that the women who come to see you have when it comes to their skin and their complexions?
So I would say across all ethnic groups, it's going to be wrinkles, skin sagging, losing skin elasticity, and then as a result of losing collagen, you can develop the wrinkles and skin sagging, and also hyperpigmentation, more common in darker skin type, but it can be caused by age, as well as the chronic sun exposure you've been having throughout the life. So those are the 3 common presentations I see.
That's interesting. And also London being, the UK being so diverse as well in Fitzpatrick skin types as well, I imagine the pigmentation is something very concentrated here. And I'd love to chat a bit about pigmentation with you because you're very well known for your work in dealing with hyperpigmentation and hypopigmentation. What are the sort of gold standard treatments that you're using in Korea that can really erase pigmentation, restore that even skin tone? Because I think in the same way that you mentioned fine lines and wrinkles, and I think we always thought those were very synonymous with aging, but I think an uneven skin tone can also make people feel like they're not as fresh and radiant as they once were.
Yeah, so common conditions will be things like melasma or solar lentiginous, so those are like age spots. So in Korea, we use a lot of devices, and the gold standard treatment we use is laser toning. So this is a technique developed in Korea over 10 years ago, and people from early 20s, they start having these kind of treatments. So I think there is a lot of myth around Korean skincare, giving the glass skin, but there is a lot of effort going into having these kind of laser facials.
That's so interesting. We always thought it was the 18 steps you were using.
Yeah, so this laser toning is a technique developed in Korea, which is a very gentle laser technique using a type of laser called Q-switch Nd:YAG laser. So in Western countries, we use it often for tattoo removals, but in Korea, we actually use it to brighten the skin and then also work on pigments, such as melasma and then sunspots.
So it's a very gentle type of energy. So it's not sort of causing any downtime. It's just sort of gradually reducing sort of the surface pigmentation and letting that luminosity come back through.
Yeah, that's correct. So initially we do this kind of laser every 2 weeks. So it's quite an intense regime, but we might be doing it for about 10 sessions initially, and then we can maintain every few months. But because this doesn't have any downtime, a lot of people just have the treatments and then they can resume their normal activity afterwards.
And it's suitable for all skin types, all skin tones. I mean, obviously you do it from a fairly young age, so it's relatively safe to be doing as well.
That's correct. And if you do it repeatedly, it can promote collagen stimulation. So we see improvement with the pores and textures. And as I said, it's not like an ablative laser where it's going to exfoliate a layer of your skin. So it's focusing on the dermal pigmentation and then improving the dermal environment. So yeah.
It's really interesting. It streets ahead of, I think, what we're doing with laser a lot of the time in the UK. And fascinating as well that it's about this sort of constant maintenance, whereas I mean, personally, I go and have one heavy-duty laser in sort of September after I've been baking on the beach all summer and try and blast it all off, but this seems much safer and more sustainable. You mentioned that a lot of people have this misconception that amazing glass skin in Korea is about the skincare. Maybe it's about the laser toning as well, by the sounds of it. But what about skincare? What are the topical ingredients that you advise your patients to be using to help future-proof their skin for the years ahead?
So the popular skincare regime is restoring skin barrier in Korea. So it's not about using retinol. Actually, not many people focus too much on retinoid.
That's a UK thing, so the really punchy active ingredients.
But as you may know, it can make your skin a bit more sensitive, and it doesn't suit for everyone, although it can be effective for, I would say, Caucasian skin, they can tolerate retinoid better than Asian skin. So a lot of skincare is focusing on hydrating and soothing in Korea. So things containing like peptides, growth factors, like polynucleotides. So those are the popular treatments to restore the skin barrier.
Everything is much sort of gentler, it sounds like, but just done on a more consistent basis too, so you don't have to go fast. I sometimes think we just want results so quickly. In the UK, that we throw everything at it and then we're upset when we have redness and peeling and downtime. You mentioned a little bit about polynucleotides there, and I'd love to talk about that as a treatment because we're definitely seeing a shift into the more regenerative injectables and sort of medical grade treatments. How are you using things like polynucleotides, exosomes, and maybe you can also explain a little bit about what they all do?
Yeah, so polynucleotides, they are very popular over the past few years. So it's made up of salmon sperm DNA. So interestingly, salmon DNA has similar resemblance to human DNA, and DNA acts like a building block to regenerate. So it can stimulate the fibroblasts to stimulate new collagen, elastin, hyaluronic acid. So this is more of a regenerative way of stimulating your own cells to produce more collagen. So there is a product called Vijuran in Korea, which has been around for about 10 years. So we are much ahead of using polynucleotides.
Been using them for 10 years?
Yeah.
Oh my goodness.
Yeah.
They've been like the hot topic for about 18 months here, I feel
Yeah,
like.
that's right. But so in Korea there is a lot of science or safety data and also efficacy data of using this polynucleotides. And we use it for not just anti-aging, but also it has some anti-inflammatory effects, so it can help with calming any acute inflammation or very sensitive skin, rosacea. So it's not just for the anti-aging, but improving your skin dermis layer.
And yeah, I think skin health as well. I mean, healthy skin is synonymous with looking more radiant, looking more youthful, looking more fresh. So it's nice to see that injectable products and treatments have taken a turn towards addressing that rather than just freezing or filling or plumping or whatever it might be. What about the exosomes? Because you're doing something quite interesting with those at the moment.
Yeah, so exosomes, I would say it has been around for about 5-6 years. It has become popular. So a lot of exosomes we talk about are plant-based. So they can be from rose, for example. So this exosome is mainly licensed for cosmetic use. So we can't really inject it to the dermis layer. So quite often we do microneedling and apply topically on the skin.
So apply it like a serum afterwards so it sinks in through those holes.
Yeah. But what exosome does is it's like a messenger between the cells. So the cells need to communicate better to help with all the regeneration process. So it's assisting that communication. So exosome is a popular treatment for anti-aging and also anti-inflammatory in acne. I use a lot. And another way we've been using it is autologous exosome. So as I said, the plant exosome, we can't inject it, whereas autologous exosome, it comes from your own blood. So
autologous meaning, yes, it's using your own resources, which is fascinating.
So you might be familiar with PRP, which has been around for some time. So PRP, again, we take your bloods and then we process it to extract PRP, and which is rich in growth factors. So we used to inject it for rejuvenation, for the wrinkles, hair rejuvenation too.
And even sort of osteo as well, sort of bones and joints, that was often improved by PRP, wasn't it?
Yeah, that's right. So, but this autologous exosome is extracting exosome in addition to the growth factors from PRP. So it's giving the extra results by improving the cell communication and then as well as providing the growth factors.
So you're actually supercharging your own resources, because that's the only problem when you use the sort of autologous sources, right? Your own building blocks. It's fine if you're in your 20s and you're in your peak health, but again, as time goes by, perhaps those resources aren't as powerful as they once were, and then you need to give them a bit of a helping hand if you want to really use them for regeneration.
Yeah, and then there is a device which can help to boost PRP by 3 times and then exosome by 13 times. So in certain temperature or UV light, it can boost the results, the efficacy of the PRP in exosome. So it's not just about extracting from your own bloods, but we are actually boosting the effect by using temperature and then UV regulation.
Wow, and can you use them for the hair, for the scalp as well?
Yeah, so actually I don't really use PRP anymore, so I use either autologous exosome or sometimes I take a small biopsy from the back of the scalp around the hair follicles. So at the base of the hair follicle, it's very rich in stem cells. So stem cell is like a mother cell, so wherever we deliver stem cell, it can regenerate into the new cell. So as we age, our cells slow down. So by giving things like stem cells, some stimulus to regenerate to the younger cells. So that's a treatment I normally do for the hairs.
I think that's really interesting, because whenever it comes to hair loss, I feel like it's always, that conversation always happens in a very male environment. we've hosted a few conversations, in fact, with hair loss surgeons. It's always a male health focused conversation. But again, as sort of life moves on, I think female hair loss, shedding, whether it's as a result of, weight loss or post-pregnancy, menopause, I think it's something that really does start to bother a lot of women. So are you seeing women come in for this, or is it sort of more of the male patient?
No, actually, I see more female patients coming for hair loss, general hair thinning rather than the male pattern hair loss. So a lot of patients, they are reluctant to go on to medication, which comes with side effects. PRP, I've been doing it for a long time previously, but the results are slightly unpredictable, I would say, and quite often you need to do multiple sessions. So it might be once a month for 6 sessions, and it's quite painful process to do the injection onto the scalp. So by using more advanced regenerative technologies like taking biopsy from with the hair follicles and then extracting stem cell growth factors and injecting it, you might just need it every 6 to 12 months. So it reduces any pain, downtime, and you get really nice results with it. So.
It sounds amazing. And then I guess you could go in with the exosomes on top and smear that all over and let that sort of get to work.
Yeah.
I mean, women, sort of unlike the male counterparts, are also far less likely to go and do things like hair transplants. So it's quite interesting to have these alternatives that are just a bit more in keeping with social life and how we sort of present ourselves. As a dermatologist, what are your thoughts on supplementation? I know we touched on it briefly with Dr. Maria as well, but how do you approach supplementation in your clinic?
So we combine a lot of regenerative medicine to the skin, a lot of existing skin treatments. So there are well-known ingredients like zinc, biotin, vitamin B12, vitamin E, which are known to be good for the skin and hair. But I also focus on ingredients like NMN and then NAD. So for those of you who don't know about NAD, so those are very essential molecules you need to produce energy in every cells, including the skin. So by middle age, I would say about half of the NAD, the level will drop. So
we know it's definitely depleted by sort of 30s, 40s.
So a lot of people are aware that we are losing collagen from our mid-20s, but we don't think about the internal things which are declining as well. So with NAD, it can be done through IV NAD, which has the highest bioavailability. If people are not really keen on having needles, then NMN is a precursor of NAD.
So that's like the building block that your body uses to then create the NAD.
That's correct. So although we are injecting all these polynucleotides, exosomes, growth factors, you need a healthy cell to be able to be regenerated. So if our cells are getting slow, or the metabolism is slowing down, then you're not really getting the maximum result from all the rejuvenation treatments you're doing to your skin. So I think focusing also on the cell aging, other than the visible signs of skin aging, is very important.
The NAD drip is a funny one. I had the IV infusion about a year ago. It makes you feel quite unwell at one point.
Correct,
You're fine for the first sort of 10 minutes and then you just go, I just need to sit down for a second and stop talking. It's a bit horrible. But then as soon as it's finished, it's great, and people say amazing things about it, and it really does sort of, turbo boost their energy levels.
Yeah. So for those of you who have a lot of symptoms from IV, then sometimes subcutaneous NAD.
So little injections straight
correct.
into the skin.
That's correct. So that can slightly reduce all the symptoms you might be getting.
Really interesting. Can you tell us about the new device that you've launched with a view to sort of integrating more longevity into your practice, the EBO2, I think you mentioned, because it sounds fascinating.
Yeah. So it's like doing a very deep cleansing to your blood. So it was mentioned previously about all the exposures from microplastics, all the toxins, heavy metals from our environment, from our food, diet. So this is like a dialysis. So we connect you to, we put 2 cannulas on each arm, and then we connect it to the machine, which can filter your bloods. So it will be a great tool for detox, so it can remove all the heavy metals, inflammatory proteins, toxins, cholesterol, and then it then infuse with ozone, oxygen, and UV light.
Because ozone blood therapy, I had heard of before you told me about the EBO2, but you said it almost goes one step further by the sounds of it, and it shines the light into the blood at the same time. What does that do?
So it's good for reducing any chronic inflammation. It can also help to stimulate your mitochondria. So it's improving your cell immunity as well. So you're doing something more advanced than just the ozone therapy by filtering your bloods first and then exposing to ozone and UV light.
How long does it take to do sort of the whole treatment, the full cycle?
About 40 minutes or so. You're connected to the device.
And it essentially takes the majority of your blood and filters it and cleans it and supercharges it and puts it back inside.
So it's about 80% of your blood will be cleansed
Wow.
and detoxed. So at one point, it's only 250 ml coming out of your body. So we are not taking all of your blood out of
You're
your
having to suddenly lie down, looking
Yes.
very pale.
But it's a lot of people, they feel really energetic even from the next day, really improve their sleep.
How often can you do it?
If it's mainly for longevity and detox, you can do it every 4 months or so.
And it's supposedly good for things even like long COVID and the brain fog and all of the mental clarity that we were talking about as well.
That's right, yeah.
Fascinating. Okay, well, I need to come to your clinic and try that immediately, if not sooner. Thank you, Jinah. That was super interesting. Get my notes in the right place. Our final speaker is Mr. Naveen Cavale, and he's a technically excellent surgeon, but he's also the only doctor I know who ever really tries to dissuade patients from having surgery, which I always love. It's very realistic and authentic. But Nav, I always feel that when women start to consider cosmetic surgery, it's normally at very key chapters in their life. Perhaps they've had a baby or they've had the weight loss or they've gone through a big life change. Admittedly, all of these things are quite emotional points in a woman's life as well. So I was wondering how you go about almost counselling your female patients who might be considering a procedure and making sure they go into it with their eyes open.
I think it's all to do with being a proper doctor. So one of my teachers, when I was sort of a newly qualified doctor, said the best surgeons are physicians who happen to operate.
That's
Okay, so if you can be exactly that, then again, going back to what we were taught at medical school, take a history, examine, and then send people off for tests and then do something. That's the neurosignal maneuver that you get taught when you drive. So if you can stick to that, so I don't know, we saw a 23-year-old woman today who wants a breast reduction, and she's only 23. So in my world, I'm way older than that, but she's very young, and she's not happy with the way she looks. But she hasn't necessarily thought through all the good and the bad things that come with having a breast reduction.
Exactly.
And so, lots of scars. You might not be able to breastfeed. There's chances things could go wrong, and I won't go into all of those, but there are some fairly big risks. So it's all about getting to know your patient and so even
helping them paint that picture as well as to absolutely everything that's involved.
And so even the simplest operation, one of the easiest in my world, one of the easiest operations I do is a breast augmentation.
Putting an implant.
Putting an implant into a pair of breasts. That takes me about 35 minutes to do, skin to skin as we call it, the first cut to the last stitch. But I'll spend an hour and a half consulting the patient in clinic, leading up to 1 or 2 consultations, more perhaps. So this 23-year-old, I did say, look, have a think about it. I hadn't thought about that. There's a whole load of new info that we gave her.
Another surgeon once said to me that the most dangerous point in a surgical procedure is the consultation.
Yep.
That's when things get missed, and that's when things get miscommunicated.
And you've got to be. It's not a sales pitch. Okay, it's a consultation. This is surgery. This is medicine. This is not a manicure. This is not a haircut. So you've got to respect that, and you've got to treat your patients accordingly. And at the end of the day, this lady, if I do a breast reduction on her right now, that could be a really good idea. That could be exactly what she wants, what she needs, what will make her happy in the long run. But what if it isn't? she's going to be knocking on my door for the rest of my
career. You're the one that has the long-term
yeah,
relationship with her.
Yeah, absolutely.
I mean, interestingly, they always say that a reduction is the one plastic surgery procedure, cosmetic surgery procedure that has the greatest quality of life improvement, which I always love. So I guess there's both sides to that, isn't there?
You've got to do it in the right context. You've got to do it well informed, having spent time thinking about it. We talk about a 2-week cooling off period, which I personally don't think is enough. You've got to be, so we sent this patient off, come back in a few weeks' time. I did that with all my patients today, I think. Send them off. I didn't agree to operate on anyone today. So bad business. But they will come back. The idea is they'll come back
in the sort of
and it's almost, I want patients to come back asking for the surgery that I've counselled them for. And if I can get them to that point, the chances of them being happy way higher, the chances of them complaining way lower, the chance of them suing me way, all of that. You know what I mean?
100%.
You just set yourself up for a better life for myself as well as for the patient.
So you mentioned the lady today who wanted the breast reduction, but what are the other concerns that women tend to have with their bodies? Why would they find their way to your door in sort of later life, and what would be their bothers?
Roughly speaking, 2 stages of life. You have the younger group. I kind of divide them into pre-kids, post-kids. It's really simple. I'm a simple soul. I'm a surgeon. Okay, so let's say the 20-year-old. I've always wanted bigger breasts. I was never the same as my friends. It's always been something I've had a thing about. So there's that. So
a lot of psychological
and there's
huge,
or one is a different size to the other, or whatever. I don't like my nose. I've never been confident. All the things that I'm sure everyone knows about. So there's that group, and you've got to be really careful because they don't know what they don't have. They don't understand. They don't quite understand what they're missing. And then there's the second group, which are the post kids.
Do you know what they're missing?
Yeah, you know what? I used to really like the way I was quite happy. I wasn't necessarily the most perfect body in the world, but you know what? I was happy. I was quite proud. I was quite confident. And then the kids came along and destroyed everything. There's that group, and you can, and actually they're a much easier group to deal with for the reasons that they know what they have lost.
It almost becomes a bit more restorative. It's not the psychological, I've never had this. It's I used to have this. Can we just get back to where we used to be, or closer to it?
Yeah, and then we've always got to be careful all the way along, in no matter what age we're talking about, what group, male, female, whatever, people who are trying to make themselves into something else. And that's where body dysmorphia or just unrealistic expectations, and I don't know, there was a word used a couple of times that always makes me nervous, supercharge, I think you said. Okay, so I don't think you can supercharge I always use, what I'm like with my car analogies. So imagine I'm a Mini. Okay, and that's what I am. That's what I was designed for. That's what I was born for. That's what I am, and that's me. Imagine now trying to put some 6-liter supercharged whatever engine into it so that I can go faster.
That's biohacking.
Exactly, but the minute you go bombing down the road, everything will just blow. The doors will blow off.
You need to do it in a way that respects your body.
Yeah, so we are what we are, and I think at the end of the day we have to accept who we are and be happy with who we are. And I quite liked what you were saying, which is, it's about what I think you said about providing service. So I talk a lot about, we're obsessed with work-life balance, for example, and I'm really skeptical of that, actually. I often think it's all about everything in life is hard work. Bringing up kids, your home life, your marriage, your planning a holiday, building the perfect home, all of these things that we think we ought to have time to do when we're not at work, supposedly is what we should be spending our entire lives.
And it only gets harder as well.
It's harder. So I always think of it as everything in life is hard work. So think of it as work balance. Do lots of different types of work, be that charity work, be that your NHS, your private practice, your business, your teaching, your whatever, your family, or your hobbies, but work hard at it. And I think that's where the adrenaline, cortisol kind of keeps you going, because there's so many people retire and just die.
Exactly.
Yeah.
They've sort of lost
and
that
so,
sense of purpose.
anyway, we've diverted away very far from surgery.
I told you,
but
he doesn't convert anyone to surgery.
No. But I think at the end of the day, coming back to the car, at some point we rust, and there isn't much else you can do other than replace the panels or have a respray or what, you know what I mean? So there is that point that we all reach, which is where my knife and fork and stitches and needles and
The
threads
scalpel.
come in. Yeah.
Yeah, exactly. I mean, you mentioned the breast reductions, obviously the augmentations,
Yep.
the uplifts.
Yep.
Within all of that, are you noticing trends? Are you noticing, we often hear, women who are doing a secondary breast augmentation, they might be having implants downsized, they might be having them removed. I think
Yep.
especially as our bodies change,
Yep.
maybe they do go through children and
Yeah.
childbirth, maybe they put on weight, maybe they lose weight. Are you seeing sort of that reflected in how women want their figures, their physiques to be in later life as well?
So, yes, I mean we all evolve as we go through life. We're young and stupid, then we get old and wise, and whatever. Hopefully, so again, another patient I saw today, later in life, had implants put in when she was 21, 25 years ago. They're a bit too large. She just feels so. When she was 21, she had nothing. I felt very self-conscious. I wanted to have something, and I did it, and I've been very happy with it. And now that I'm older, they just feel like they're a bit big, and they're just a little bit. They enter the room ahead of me. They've served their purpose, and now I'd like to downsize. And again, it's not straightforward because nothing comes without a price. Everything has a cost. So great.
Sorry, I know you carry on.
Had implants when she was younger. Now she wants to downsize. Yes, can do, but if you take big implants and you put smaller implants into that same pocket, they will probably droop like a ball in a sock. That's what you're worried about. So we had a long conversation. Again, I told her, go away, think about it, come back. I said, look, what about if you have your implants removed, and then why don't you wait 6 months, a year? Number one, that will give you a chance to see how you feel without them in anymore, because life has moved on, and actually it may not be that bad. You've gained a bit of weight, and maybe you've now actually got something there that you didn't realize you had.
Obviously.
And actually, if it's awful, then you can come back and have smaller implants put in. And instead of going straight from big to small when they might really droop, why don't you go through a couple of steps, do it slowly. And it is like everything we've been talking about. It's all in moderation. It's all gradual. It's all
taking
gentle.
Your time. It's not
Yeah,
immediately jumping
it's
to
nothing.
do something
Nothing
with
is
a
a
quick
fast
fix.
fix. Surgery, you might think surgery is a fast fix. Cut it out, stitch it, lift, pull, whatever. Yes, but as I said, it doesn't come without a cost. It doesn't come without consequences.
Where does fat transfer fit in? Is that something you would integrate as
Yeah.
well?
So, I mean, two places. In the breasts, we're doing more and more fat transfer, but probably not a straightforward substitute for implants because you need larger volumes.
It wouldn't hold the
and
shape as well
so
as an implant.
the woman who wants to have larger implants probably doesn't have an awful lot of fat in her body anyway for you to take. So that's always a limiting factor. So we tend to do breast implants and then augment with fat transfer quite often, or if there's an unusual situation. The last fat transfer I can think of was asymmetry. So we did a reduction on one side and then we fat transferred the other side because one was really big, one was quite small, and then we kind of averaged them out a bit. That's one area where more and more fat transfer is happening. There's been a bit of development, but it's kind of stumbling and stalling and coming and going with stem cell enriched fat transfers, in mixing it with all. I'm still not convinced any of that necessarily works yet, but it'll come. Then fat transfer to the face, which has had bad press in the past because we were putting great big lumps into the face. And the problem is, as you get older, your face thins, or at least everything goes south. But the fat that you've had transferred, it never forgets where it came from. So if you took it from your tummy and you put it into your face, it still behaves like tummy fat. So if you gain weight, it'll get bigger. So again, because cells are clever. So we're doing much more gentle nano fat, micro fat type of transfers.
Really purifying it to making it tiny.
It's not so much. It's more. you know what, again, it's crude, it's simple. I'm the simple person on this panel, okay? I'm not talking about really clever stuff. We literally filter it back and forth through a kind of micro sieve. You now end up with this very liquid paste, which may not have stem cells in it, which may or may not have other factors in it. But it's a lot gentler, it's a lot more subtle. We're not doing wham bam, great big fat transfers.
It's almost like a little adjunct to maybe
exactly,
doing another
yeah.
facial
So it
surgery.
tends to be along with facelifts or blepharoplasties or a brow lift. We're filling in hollows because ultimately I think we've overplayed volume loss in the face over the years, which is really interesting because fillers are now, I think, well and truly on the way down.
Very much.
They're not going to disappear. They have a role, but they're not doing all the things that you may have heard about over the years, which is they lift and they rejuvenate.
Well, people are sort of looking for those alternatives. You know, we know that we're losing the collagen. We know that the facial volume is depleting. So there's
life
what
is
else
happening.
can we do? Yeah, life is happening.
Yeah.
Constantly. You mentioned the eyes, which I think is quite interesting as well. I think it's often the first surgery that a lot of people start to consider, even if they're sort of one of these people that always says, I'm never going to go down the surgery route. I think eventually we start looking at our eyes and just going, I can see it's all sort of falling now, and it's sort of getting in the way of your vision and whatnot. And in fact, I think it was a breast surgeon who once said to me that he advises every woman, if they're going to have one surgery, just to get their upper eyelids done. I thought it was fascinating. But what are your thoughts on that? Is it something that we should be doing, I don't know, from a younger age? Is there a certain point to be doing it? Should we be incorporating it with other techniques?
So starting younger is controversial, but there is something to be said for it. And this is me, you know, obviously I would say that, wouldn't I? You know, trying to encourage everyone as a you know, come
well,
get.
Your body recovers better.
Well, your healing ability is better. Your skin elasticity is better. You generally bounce back a lot quicker. Your downtime is less. That's not necessarily the only reason to do it, but actually, there's an awful lot to be said for example, eyelids. Okay. Having, and I'd say lower eyelids almost more than uppers, actually. A lot of women now, instead of upper eyelids, it's thinking about having your brow done. I need a brow lift. My eyebrows have dropped down. They no longer sit on that bony ridge. They ought to be there. And it's that funny feedback. You know, the minute I do that, I feel more awake. Okay, yeah.
And after a while, like the toxin just doesn't.
Toxins. You've got to be careful with toxin to the forehead, and baby Botox is something I'm dead against because it's being put into foreheads of young people. If you paralyze that muscle, you can no longer raise your eyebrows, which is what we want if we have, because you don't want the wrinkles and the creases. But if you can no longer raise your eyebrows, it means the lowering eyebrows muscles are winning, which means so you end up with what I've got. I've never had Botox, but you end up with brow descent, which means you then end up with me needing a brow lift. Great, you know. So
what do you do from a younger age? I mean, I have Botox in my forehead every 3 months, but am I doing something detrimental there?
Maybe you might be setting yourself up for a brow lift earlier. Maybe. Okay, you might be. So just gentle, be careful. Perhaps not bang in the middle. Maybe concentrate on the frown lines, the crow's feet, and then a little bit just on the outside. Maybe not in the middle is what I tend to say. Having surgery earlier. Preventative surgery, preventative Botox, preventative filler, I'm not so sure about. I don't think it's preventative. I think what's going to happen is going to happen and you get it treated. What you need to balance, we're doing facelifts on younger and younger patients now. You know, it is not uncommon for early 40s, even late 30s. And you might be going, that's crazy, but certain people, the effects of time, gravity, sun,
and sometimes genetics as well.
Yep, exactly.
Particularly sort of around the neck area.
Exactly. So there is something to be said for doing it earlier whilst you're going to recover, which means that you're less likely to need another one when you're older. The other stuff is also combining it with everything else we've been talking about today. It's not just about cut and stitch. So lower eyelid is the classic one now. You know, we are doing more and more transconjunctival lower lid
on the inside.
through the inside of the eyelid. And that lifts the muscles back up again, okay, because gravity. The bone might be thinning, you can't do much about that, but everything else has gone south, so you can lift all the deeper structures from inside. And then for the skin, which we've always been very scared about with lower eyelids, removing too much skin, lasering. Okay, erbium is what I use. CO2 is another one.
Just to resurface.
Yeah,
clean it all
and that
up.
will tighten the skin up. And actually, the combination is brilliant, rather than risking an ectropion or an
Yeah.
odd-looking eye.
On the note of skin tightening, I mean, you must have seen, as I'm sure everyone has, the real spike in the weight loss medications, and particularly patients, I'm sure,
Yeah.
coming to you who have lost a lot of weight suddenly, face, body.
Yeah.
What sort of repercussions is that having for you as a surgeon? I guess a lot of skin to try and tighten.
Yeah, I mean, we're going to see a huge upturn in all of that. You know, I think first of all, body. I was at a plastic surgery conference a couple of weeks ago, and the number of colleagues who've been on the Ozempic or Mounjaro, it's unreal. And there was
When you haven't seen
it was
someone
like
for 6 months.
it was like a competition, yeah. And there was some impressive, changes that I saw. And a lot of people actually that were now looking like, there was one particular person that I remember thinking he was quite a sort of stocky, kind of happy-go-lucky looking guy, whereas suddenly he now looked like an old man.
It does completely change
Yeah.
your almost the energy you give off. Sometimes I think if you lose too much weight.
I think be careful with that. Like everything, do it gradually. There are no magic quick bullets that will mean that in 6 months' time you can suddenly drop several dress sizes. You can if you take enough of this medication, but
there will be side effects.
But there will be side effects. You want to give the time. You want to give the skin time to shrink. You want to give your body enough time to compensate and recover, and it's all holistic. It's all, everything has consequences. Everything. So losing weight quickly, like blowing up a balloon. If you blow up a balloon, when you deflate it, it never goes back to the size it was when it came out of the packet. Okay, we know that. Okay, you all know that from when you were kids. However, if you blow it up and you leave it blown up for ages, it'll go back down to less of a smaller size, and that's the same thing we're getting at. The longer you have been a larger size, the less it's going to shrink. However, if you let that balloon down slowly, bit by bit by bit by bit, over a few days, it'll go down closer to the original size. And skin is exactly the same thing.
Analogy.
Yeah.
How are you then tightening the skin? Is that something you can do?
Yeah. So surgery, number one, cut it out, the excess. So like taking a dress in, that's what tummy tucks, breast lifts, face lifts, brow lifts, you name it. That's what that is. Secondly, if we're combining it with things like Renuvian, which I love. So
What's Renuvian?
Renuvian is, you may have heard of Body Type, Face Type, Morpheus, all that. It's the other machine that I think is better, but I'm not sponsored by them, by the way.
It's radio frequency, right?
It's radio frequency, but it's you create a little helium balloon under the skin where you've done liposuction first, so you now have the space. You've removed the fat with liposuction. Now you just have the fibrous septi that connect your skin to the deep tissues, the stuff that gives you cellulite. But it connects your skin.
Bumpy and it's all tethered.
And you're tightening those septi to pull the skin down. That's what skin tightening is. So that's what face type, body type, they all do. Renuvian, I think, is just a lot more controlled, a bit like I like erbium more than CO2 laser. CO2 is fairly crude. It's kind of like sandpaper, it's fairly. It's a pretty crude machine. Erbium is a lot gentler. Renuvian, similarly, you create a helium. But those plasma balls? They're like glass plasma balls. You put your hand on, and the lightning comes, and you just see your hand. That's what Renuvian is. It's basically, and those plasma balls are filled with helium, and you're then passing electricity, which again, crude burns heal contracted. If you burn, scars always are contracted, tighter, and you're taking advantage of that. So we're doing liposuction, Renuvian, combining it with tummy tucks.
Is it an option if you've had a surgery sort of years before and you just need that sort of final bit of skin tightening and finessing, or do you always combine?
Yes and no. Best to combine. It is best to, one lot of downtime, one general anaesthetic, one stay in hospital, one lot of blood loss, okay, if you want to be crude about it, because surgery does, you do bleed. You want to try and minimize it. One life event. call it. Okay, surgery is a life event. Okay, it's the same as buying a house, getting a new pet, getting married, getting divorced, having kids, whatever. It is a lot. So you want to concentrate on it properly at that time without other things getting in the way. So generally, yes, combine. If you've had something done in the past, can you have it as a top-up? Maybe. It depends on what you've had done before. Mm-hmm. If you've had fairly aggressive liposuction, that in itself will cause scarring, so it might be difficult to get back in there again. It might be riskier, and the effects might be less. Mm-hmm. So yes and no.
What are the sort of areas of the face and body, final question, that you're seeing really good results with it?
So for the face, again, you've got to be really careful with Renuvian, for example, or Body Tight or Face Tight. The neck is where it really works well. Got to be really careful here because it is a nightmare to go back in later on and do a facelift on someone that's had radiofrequency or threads or too much filler. Botox is way more forgiving, but the neck, it does work well because we don't like doing big volumes of liposuction. No matter how heavy your neck is, you don't want to liposuction the neck, especially in a young patient, because that fat will go as they get older, and they will thin out and start getting what we call the cobra head deformity in the neck from over liposuctioning. Mm-hmm. So gentle liposuction, we want to remove the fat that's not superficial to the platysma muscle, which is the anti-strangulation muscle, one that rodents have going all the way down their body that shakes when you can. Yeah. So that's the platysma muscle. We've just got it here. You don't want to remove the fat superficial to that muscle. You want to remove the fat deep to it. Mm-hmm. The problem with that is that's near clockwork, really scary stuff, nerves, glands, blood vessels. So actually, maybe gentle liposuction and then gentle radiofrequency, but actually probably to get a really effective solution, it's probably a surgical neck lift to remove that extra fat and to tighten up the muscles and to, I've got a few bands. If you try, imagine someone strangling you, look in the mirror, you'll see the bands. That's those are the platysma bands that we sometimes cut.
Inject with Botox a lot of the time.
We can inject with Botox.
You also don't like that.
Maybe.
Like my treatment plan.
but actually, again, it's literally releasing it.
It's super interesting to get your perspective as a surgeon, though, because I think there are a lot of these things we do as sort of the non-surgical, the preventative, like you say, the rejuvenation. And actually, I think when you sort of really look ahead and you think, but what is this doing in the long term, and overuse of these treatments, what am I going to be coming up again? I think that's an important point to be making.
So I think, with everything that we've been speaking about, ending with my crude hammers of treatments, as it were, think holistically, think long term, think broader, don't rush, don't look for short term fixes because they will usually come with long term problems. Same thing is for surgery, it goes for surgery, don't have some great big uber surgery just because you want to turn yourself into, I don't know, some thin waist, you know what I mean. Extreme things generally come with a big price and a lot of regret.
Agreed. Well, that was a very sobering note to end on, but a very important one. Thank you.
Sorry.
Thanks so much. That brings us to the end of tonight's conversation. It's been fascinating for me to listen to all of you. I think all of you have sort of picked up on this idea of, hyper-personalization. But also, surgery aside, I think sometimes when we think about future-proofing, we do think it's about a really big change. But actually it's about these tiny little incremental adjustments and edits, whether that is through surgery, whether it's through the regenerative therapies or the simple everyday sort of adjustments that Maria was talking about that we can make as well. And they really do add up to make a big difference, I think, as time goes by for us women. We do have time for some questions, so if you'd like to ask our speakers anything, they'll be happy to chat. If not, they'll also be around, I'm sure, for a little bit at the end. If you do need to scoot off, please don't forget your goodie bags. They should be outside. And if you'd like us to connect you with anyone, then you can just leave your referral card and we'll make those connections. But were there any questions? No, we must have covered everything.
I am one from Maria, sorry. You mentioned supplements. Do you think it's better to invest more money in the expensive kind, or like something from Holland and Barrett, Does that work just as well, or is better to like spend a lot of money?
Really good question. So it depends on what the supplement is. So vitamin C, cheap as chips, ascorbic acid, Holland and Barrett all day long, 2 for 1. NAD, you need to... a good friend of mine, Dr. Jenny Goodman, who is a fantastic doctor, her piece of advice is you have to go with a magnifying glass and read, because it's in such small print, what is in the supplements, because you don't want junk. That's the important thing. So you just have to be discerning, because it could be that a really good brand has excellent vitamin D or whatever it may be, and then their other products aren't that great. So I never say use one particular brand. You need to be discerning and cherry pick.
That was great vitamin C advice. I'll remember that.
I was going to say, I always ask my patients if they're on supplements, are you on the cheap ones or the decent ones? Because the cheaper ones quite often have impurities that you just don't know about, and quite often those impurities make my patients bleed during surgery. So that's something that I worry about. So yeah, don't get the cheap stuff, but get stuff from a well-regulated market, and the UK is pretty good for that kind of.
What about magnesium? There's so many types of magnesium glycinate, magnesium citrate. Which one?
So you go for the combination. So to be honest, when it comes to magnesium, I'm not too picky, but in an ideal world, I'd go for something like Magnesium Breakthrough by Optimisers, or 7-salt magnesium by Jinah, because they contain a lovely balance of all of them.
Good question.
There's a company called Wild Nutrition.
Called Wild Nutrition.
Wild Nutrition, okay.
I have, yeah.
And they do everything, all the vitamins are supposed to be informed. How
Mm.
do they do that?
They're like food state. I mean, they sort of extract it all from raw ingredients of fruits and vegetables. And I think they find the supplement and what it's found in, and it's naturally occurring fruit or vegetable,
Okay.
and then they pack that into the nutrient. I mean, they don't do NAD.
Yeah, you want to avoid the bulking agents and yeah, that's good. That's good.
So you do get what you pay for.
Yeah. So I've actually didn't. There was I had 2 patients taking niacin B3, and one had I don't want to name and shame, but one had a Holland and Barrett one, and then one had a allergy research group one. And you're meant to, if it's immediate release niacin, you should flush. And the Holland and Barrett one did nothing. Whereas the allergy research one, within 30 minutes, big flush came. So there, the proof is in the pudding. Obviously, not all supplements give you that telltale sign. But to your point, get good ones, and ask your doctor.
It's bioavailable, so your body's going to absorb it.
Yeah.
I guess a lot of it comes down to knowing your own body as well and keeping track of things like that, like you said. Oh, lady here in the black top.
Can I ask about collagen supplements and what you...
Such a popular question.
Yeah,
I love
sorry.
it.
And all the gels that you could get that supposedly full of collagen, or is it better to take a gummy? Is there better route, or is it all a waste of money?
Who wants to do
I
this
think that's
one?
a question
Jinah?
for you.
Jinah?
I think if you are doing it for skin, I wouldn't really encourage taking oral collagen supplements. The molecules are too large to be absorbed to your, through the gut to the bloodstream and to reach the skin. So I think directly treating the skin, I mean, the topical agent in terms of topicals like retinoid is proven to be good for collagen stimulation. So I think using something topical is a better way of stimulating collagen.
Don't they often say as well it's good to try and get it through natural sources like bone broths and things like that? Anyone else? Collagen? No? Okay, hopefully that was helpful. Hi.
Thank you very much. Very interesting discussion. And I have a question to Dr. Maria about hormones. Very interesting topic. What's your view on keto diets, intermittent fasting, reconstructive hormones, and also on physical exercising? There are lots of now cycle syncing showing you how you need to exercise, and it does feel like you kind of can like a few days a month, and then how can you understand whether the exercising actually is stressing you out, and how much is it true like cycling working on women, to actually level the stress?
If you're if you exercise and the next day you're worn out, then that's a big red flag for adrenal fatigue. In terms of cycle syncing, I think there's a lot to that. In terms of hormones and exercise, it's going back to what I said about adrenal stress, which is if you're wherever you are on that spectrum, it will steal from your sex hormones if you're compromised in any way. One of the best ways to increase testosterone is weightlifting, and you don't need to do that a lot, but it's really, really good. But in to your point of intermittent fasting, again, it's good if you've got a full tank and you can cope with that intermittent fasting. But if you've got $5 in the tank and you're spending $8 through intermittent fasting or prolonged heat exposure, prolonged cold exposure, so cryo, sauna, over-exercising, you will ultimately feel it. Maybe not the next day, but further on, you just won't have that resilience. You won't you won't have that physical resilience, that mental resilience.
It's interesting. It's like those physical stresses you were talking about. Was there another? Sorry.
My daughter seems to be under always chronic stress. She's studying medicine. She's always stressed, not sleeping, constantly tired. Yeah. What can you do in that situation? Would you suggest meditation?
Stop studying medicine. Doctor.
I just gained weight. She's just.
Which is cortisol.
But it's so interesting, and actually when we were in Dubai we hosted an event on stress management, and there was a girl who must have been in her mid-20s who put up her hand and said, at my age, we have to just keep going, and we're working and we're studying, and unless we're like completely on the ground and like dead by the end, we don't feel like we've achieved anything, and then the cycle starts again. And I do think it's a bit of an epidemic with that generation. I mean, yeah, to your point, like how can you stop that generation from becoming chronically depleted?
She has gained weight, but I don't that's how I can problem. I know it's stress levels.
It's going to make it worse.
Is there testing that you do for cortisol levels, or would it be saliva testing?
Yeah, saliva or urine. You can do a blood test, but the thing is to really understand what your cortisol is doing, you have to take it at various points of the day. And I wouldn't want to bleed someone 5 times in a day. Hence, urine or saliva, which are really good markers.
Yeah, I guess it's something we should be looking at a bit earlier as well, and not just thinking about it in later life. It's starting sooner and sooner. Was there another question on this side? No. Oh, lady at the back there.
LED light therapy? Any kind of advice on that, or does it work?
Jinah? What are your thoughts on LED light therapy? I'm like skin, it's Jinah.
I'm not the biggest fan of LED, to be honest.
Are you not?
For skin. Yeah, so I do it as a lot of adjuvant treatment, but LED alone, I think there is a limited evidence.
I guess people have tried to integrate it into their at-home sort of routines, haven't they? As that, we're always told, go into the clinic, do your treatments, then go home and do your homework and sort of repair. But Nav, what do you think? Do you use it in your clinic?
I mean, not so much LED itself, but the IPL broadband light stuff does work after surgery. I think it does help scars heal faster, better. So there's definitely a role for it there. I don't know about home LED. I suspect, like a lot of these things, if the machine you buy that you will get at home is probably not going to do very much. I suspect.
I mean, it will never be as powerful as obviously what you can do in clinic, a sort of professional grade treatment. But equally, like I said, a lot of people are just trying to maintain the results and chip away at it. I don't use one, but I'm fundamentally lazy and I just can't commit to it. But I have friends who swear by their LED masks. Maybe it's placebo. I don't know.
Not
if
for
it works,
skin,
it
but
works.
if you're taking methylene blue, you must use red light therapy because that's what activates it.
What's methylene blue?
Methylene blue. Okay, that's a story for another. Yeah. But essentially, it just chucks electrons around and it balances. It gives you more energy. So if you see
it's a medication or it's a treatment?
Yeah. So it's a supplement. It was originally used to dye denim blue, And you see a lot of biohackers using it, and they have blue tongues. But you
Really?
Yeah.
Wow.
We'll talk about that
Oh
next
my
time.
God.
Oh, I just get pharmaceutical grade and make it myself. I'm yeah.
The couture version. That's really interesting. Yeah, next talk we'll have to dip into that one a bit more.
I'd like to ask a question about the blood flow. You said the detoxing. What's that blood flow?
The EBO2.
Yeah. How would that affect if you say have high cholesterol or you have other issues like circular, vascular? How do you deal with that? For example, I'm just thinking of the plaque, for example, in the arteries. Would it not affect any of this?
I guess it clears it out.
There are list of contraindications, so I wouldn't do it with anyone with heart problems or any active. Yeah.
If there aren't any more questions, I think I'll. Oh, sorry. There's one more at the back.
Sorry, I work a lot with hair, and I use the analogy that hair is like a pond. So if someone said that their hair was thinning, I look at if they're drinking enough water, what they're eating, their diet, and everything else. Would you agree with that, or would you instantly look at the external in terms of their scalp and where the hair's growing from?
So with the hair, you need a very good nutrient. So I totally agree that you need a good hydration and good diet as well. So it's not all about like stem cells. So for a hair follicle to be active, you need all the good nutrients and good blood supply as well, which is delivering all the good nutrients to maintain it active. So I agree with supplementing with good diet and hydration.
His hair is so complex, isn't it? There are so many things that affect it, and hormones and stress and Ozempic and yes, everything at the moment. If there aren't any more questions, I think our panelists will be here for a little while longer. So if you have anything else to ask them, you can have more of a one-to-one. But firstly, a big thank you to Lanserhof for having us tonight and hosting us so beautifully as always. A big thank you to everyone here who came. I hope you found it really interesting and informative. And we'd love to have you at more events. So please do register your details with us on our website, or otherwise you can leave your email on the referral card, and you'll always be the first to know when we've got another talk coming up or a festival or anything else. And finally, a huge thank you to our amazing speakers, our Beauty Triangle.